right, so this is called Taming the Dragon, Botanical Approaches for IBD, which is inflammatory bowel disease. And I named it this because like any inflammatory condition, its experience often is described by people as an experience of heat, intense heat and painful and all kinds of scary symptoms. And for me, that really brings to mind this kind of picture of a dragon breathing fire. And so how can we address IBD, which is really a couple of specific conditions botanically, is what we're going to be doing today. Let's start. Inflammatory bowel disease, or IBD, is not particularly common, but it certainly has got a significant number of people affected, about 1.3% of adults in the United States, and the numbers are increasing. So it's probably becoming detected more and more, but it's also possible that the incidence is increasing. It's seen more often in developed countries like the United States and Canada. So the two conditions we're talking about here are Crohn's disease and ulcerative colitis. And I've got a couple slides here just to remind us all the differences between the two. This one I like because it's really easy to just look and see that Crohn's disease can affect all different parts of the GI tract. So it's showing you kind of patches in the colon, which is sort of the big tube. And then in the small intestines too, the darker pink are the patches. And so patchy inflammation is characteristic of Crohn's disease. Imaging is typically going to be done as well. Abdominal x-ray really is only done if you suspect a bowel obstruction. And people typically are going to have to do some contrast where they can quickly see if there's a stricture or obstruction. The double contrast barium enema isn't used much anymore. It used to be used a lot to show that narrowing strictures, etc. CT scans are often done just to kind of rule out masses. We can see abscesses through those, and we can see a perforation in many cases, but not all cases. And so if it looked like more of an emergency issue, a CT is certainly going to be done. So we have a couple of classes of medications here. Glucocorticoids, so there's our anti-inflammatories, right? Like prednisone. And so I'm going to start with budesonide because this is a type that's really preferred in IBD. Budesonide is a steroid. It's got a really high first pass metabolism though. So only about 10 to 15% of this makes it through the first pass metabolism, meaning when it gets broken down by the liver. And so there's a less of a chance of the systemic side effects that steroids can and will cause when people are on them for longer term. And so there's quite a few of these anti-TNF factor agents. The most commonly one used is adalimumab or Humira. And Humira, if it helps you remember, is one of the few ones of these biologics that's fully human antibodies. And so for some people, you know, the mouse or the various animals, hamsters that are used to make these antibodies aggravate them. And so Humira is human. It's used for both Crohn's and ulcerative colitis, and it's a sub-Q injection. So typically someone is going to be taught how to do this and they'll do it at home. But there's a variety of elemental diets. I prefer the ones that don't have a lot of junky additives, and they can induce remission. You're typically making this powdered beverage and drinking that multiple times a day, and there's a specific way to calculate nutrient needs that's a little beyond this presentation. I'm going to combine some of these inflammation modulating herbs with the most appropriate adaptogen or immune modulating herb, and I've listed a bunch here. We don't have too much time to go into all of them, but Schizandra I like particularly if I feel like the chi needs to be astringent and people are just kind of leaking out their chi everywhere, or maybe there's a liver function that I want to address.